My name is Julie Mirkin, for those of you that don't know me yet, and I have had the pleasure of being the chairperson of this track of care transitions and technology. I wanted to take a few minutes today really to reflect on the amazing learning experience that we've had over the last 2 days and share some of my pearls of wisdom, and we have about 10 minutes to do this. I thought if there's anyone that also has some real amazing pearls of wisdom that they learned or are anxious to share, we can talk about that, and then we'll go right into our first speaker at 8:10 a.m. So once again, just a reminder to please complete your evaluations. It's very important to the World Congress to get feedback on what we've done great, what's not so great, or we can improve upon, and also any speakers or topics that you'd like to see for the future would be greatly appreciated. So how many of you thought that this was a pretty awesome conference in the last 2 days? Yay! How come every hand didn't go up? Is that because you just had the coffee in your hand? Oh, of course I know that. So I thought it was really awesome too, and there's a couple of things, as a very experienced professional in this world, there were several things that just really I had to think about, that I really reflected on, that I hadn't thought about in that kind of framework, and I thought I would share some of those pearls of wisdom with you. And so one of them is talking about healthcare in general, and how it really, on the first day we learned that it's not just about the physical and the psychosocial, it's really about the social. And so how hospitals and health systems and organizations are starting to address not only the medical conditions of the patients, but the social environment of the patients. And coming from New York City, we have a very significant homeless population, and we have some unbelievable experts in homelessness. And the one thing that I learned from them is they would always say to me, if there is not a roof over the patient's head, nothing else is happening. That's your first priority. So hospitals are starting to work towards respite care, housing, and such. So that's a pretty different paradigm shift into what we're normally doing as hospitals and health systems. Also, access to care, the disparities among the zip codes. We know that there are disparities, but I think several of the speakers really highlighted significant disparities among the health codes. And I am actually going to be starting a new position when I get back in Brooklyn, New York. Anyone ever hear of Brooklyn? Yeah. So the big sign when you get into Brooklyn says, you're in Brooklyn, forget about it, one word, which I'm definitely going to use in future PowerPoints. But what I learned in the hospital that I'm going to, which is a 560-bed academic level 1 trauma center, is that their average age is 39 to 54 with COPD, heart failure, diabetes, and renal failure, because in the area that I will be working in, there is such limited access to health care that people are coming in so sick. So my challenge with the new team is to really transform the care that we deliver in Brooklyn and really move the bar on opening up access to all patients. So that was pretty highlighted to hear about different areas like in Maryland and California, where there's such a disparity on not only access to care, but in patient outcomes. I think the nudges was another pearl. We all know it's important to nudge, but I think having a formal process to encourage patients to access their care, follow up on their care, call them and let them know. It's a lifeline to let them know someone actually cares about them, and we want to make sure they get the care that they've received. So we've heard it in terms of health coaches, navigators, how we train people. So I thought that was a very interesting takeaway as a best practice. We heard a lot about readmissions and how to fix them, how to assess for them, how to look at root cause analysis data and focus on the right thing. I've always told my staff, do you know the best way to assess the root cause of an organizational readmission? Anyone know? Ask the patient. Keep it simple. Stupid, you know the KISS? I work in an organization that has incredible technology, and they were talking about all these gadgets and doodahs and whatever to assess the dynamics of patient blah, blah, blah. And I said, no. You go into the room and you say, I see you just got readmitted. What happened? And when I did that in my organization, we found that there were two major things that came out. There are things that you can change that are really easy to change, and then there are the big things like social determinants of care that are going to take a longitudinal approach to change. In my organization, when we asked the patients, why did you come back, we heard two things. One is, I speak Spanish, and my directions and all of my information was given to me in English. And so what I learned is that in many of the hospitals that I cover, they don't have printers that can print in Spanish for a Spanish population. Those are shame on us kind of things that we can fix, and we did, and that no longer became an issue. The second thing that the patient said is everybody constantly asked me about my medications. Do I understand? Do I understand? Nobody asked me if I could afford them. Nobody asked me if I could get them. And so I couldn't. So I didn't. And so here I am. And so we developed a bed table pharmacy program, including charity care, to ensure that every patient left the hospital with a bag of their medications, and so they didn't have to go to CVS or Walgreens and get the meds. And how many of you know when you're sick, I'm guilty of this myself, and the doctor orders you a prescription, do we all run to the pharmacy to get it? No. I go home, I don't feel good, maybe it's 4 hours later, I call my husband, I said, please, could you pick up my meds? Well, imagine patients that have less access. So that's an issue. So readmissions, we heard a lot of great information about how to address them. And innovation. I've heard so many amazing things, and I know we're going to continue to hear that this morning from our next speaker, about hospitals at home. I mean, the rest of the world is doing it. In other countries, and America has not embraced that. But imagine being able to be discharged from the ED and admitted to your bedroom and get the same level of care and be having the same kind of outcomes. So very innovative things. And finally, I thought it was really awesome that we had so many government representatives here to talk about how they're supporting removing barriers. How many of you live with barriers that are regulatory every day, right? It's like, why can't the government figure this out? And I was inspired by the speakers from HHS, I have HSS at home, HHS and other regulatory bodies to say, you know what, we hear you and we're committed to changing that. So once again, there are many people solving problems in this room, many vendors solving problems out there. Network, get to know each other, find each other on LinkedIn, share best practices. This is an opportunity. And as I said yesterday, find one thing that you can do when you get back home to implement that you've learned from this conference, and then you can consider this a successful day. Does that sound like a good plan?